So I want to talk a little bit about setting boundaries as a med SLP. I think, we got into this field, we got into this profession because we wanted to get into a helping profession and we wanted to help so many patients and we wanted to save the day. And I think somewhere along the lines, we kind of got taken advantage of, whether it's our fault, whether it's our colleagues' fault, who cares whose fault it was. But, I think a lot of different things kind of went into this. And I think there's a lot of SLPs out there. In fact, I know there's a lot of SLPs out there that are feeling so burnout because they're being stretched so thin and they really don't have many boundaries set in their facility. So I want to talk about this a little bit today because I think, you feel so overworked and a lot of med SLPs are salary, which means we don't really care that you work 40 hours a week. You should probably work 80 hours a week and see all your patients, but we're still only going to pay you this much. And that's crappy. And that leads to so much burnout. And it leads to just us really despising our jobs, hating going in every day. And, it's almost like the more you bend, the more you say, no problem, I'll stay late tonight, or I'll finish that paperwork after I see this patient at 9 p.m. It's like the more you bend, the more they pile on you. And there's got to be a stop to the madness at some point, right? Like you cannot work 72 hours a day. It doesn't happen. It's not possible. And I know sometimes some DORs will pile it on you if you allow it to, but I really want to talk about how to navigate those conversations, because I've had some conversations with some other med SLPs who've said, once I put these boundaries in place, I feel so much better. I show up for work so much better. And I feel so much more respected by my colleagues and by my DOR and by my administrator for saying, no, these are my boundaries. And this is the time that I'm going to show up for my patients. And I'm going to show up for them 100%. Because I think if you're showing up for them 50% because you're working 92 hours a day, that really doesn't help anybody. That doesn't help you and it doesn't help our patients. So what I wanted to do is I want to help you have these conversations. I've got a team of mentors in the Med SLP Collective, and we've created some scripts. We've created some email dialogues for you to have to start these conversations of how you can stand up and set these boundaries. Because like I said, it's so important for you. It's so important for your mental health. And it's so important for your patients. Your patients deserve you to show up 100%. I know I'm a mother of a child with special needs, and I can tell when some of his therapists show up ready to work, ready to give him 100% for the half an hour that they're here. And I also know there's others that show up because it's a paycheck and they're working 97 million hours a week and they're just bursting at the seams. And I don't think that's fair. And I think our patients deserve better than that. And you deserve better than that as well. So in the Med SLP Collective, we help you have these conversations. We help you craft these emails, and we're here to support you in making those conversations. We have a team of mentors that have helped to write these scripts for you. And again, I think that's something that's so important for us to have lifelong career fulfillment and get the best outcomes for our patients. Hi, my name is Theresa Richard. I'm a board certified specialist in swallowing and swallowing disorders. I am the creator of the Swallow Your Pride podcast. I am the owner of a mobile fees company, Mobile Dysphagia Diagnostics in New York, and I am the founder of the Med SLP Collective. Thanks for watching.